All right, welcome back to Daybreak on this 6th day of July 2020. This is the day that the president, like I said earlier on, is expected to make that decision on whether to reopen or not. Of course, because of the situation that has been happening in the country, we'll be looking at the numbers later. But I want us to speak to the governor of Isiolo, who is also the chairperson of the Health Committee of the Council of Governors. That is Dr. Mohamed Kutu. Good morning, Governor. How's it going?
Good morning.
Right, and of course, this is the day that Kenyans have been waiting for. First of all, they waited for 6th of June, and we were told that at that time there were several reducible minimums that the country had to meet before we can reopen. Do you think we have now finally gotten to that point that we can go ahead and reopen the country without losing so much in terms of the pandemic effects in the country?
Well, I think I can say that there's not a time when we can say the country is fully ready. I think we have to balance between preparedness, which is a continuous process. Even after opening, the preparedness will have to continue because, as you have said so far, in terms of beds, although preparedness should not only be judged by the number of beds only, but since that is one of the yardsticks, then only 15 counties have attained that so far, but more will continue attaining, and therefore the preparedness is a continuous process. And as we look, we have to really understand the president's predicament, where he has to care for the people's lives by saving them from the disease, but at the same time considering the economy, which is also really getting a lot of beating. And therefore a lot of Kenyans are falling into dire situations of requiring food, requiring rent payments, food. So I think a balance has to be reached. So when I don't know what is gonna announce this today, but what I can see is that there has to be juggling of those two very careful in such a way that we do not open all the floodgates at one go, like schools and churches and businesses, so that everything is as buzzing as before. But somehow a slow opening of the gates in such a way that while the preparedness is being attained, also some livelihoods are being achieved through businesses, especially the lower income groups, the juakalis, the artisans, the people who can only live from one day to the other.
Right.
So I think those are very key balance that has to be achieved.
And when I look at the list, because you say only 15 counties have met that threshold of 300 bed capacity, I'm just wondering, because I do not see Isiolo County on that list. What has been the challenge to reaching this point? And would you know how many beds now you have?
We are having 217, and I'm sure in the course of this week we should be able to attain the 300 capacity. I think we should also not just only look at the bed capacity alone. There is the issue of those who fall very sick, like requiring the HDU or ICU facility. I think we are having that in Isiolo right now. We also have to look at how many health workers have been trained, because we have trained 100% of the public health workers, those who work in government. And now we have actually crossed over to those who work in private facilities.
Right.
So we also have to look at the issue of availability of protective gear for the health workers. Also how much awareness have we done? We need to make sure the communities are fully aware on issues of hand washing, social distancing, also putting hand washing stations at very critical areas like the markets, like supermarkets and crowded places, So I think all this has to be put into consideration alongside availability of the 300 bed. So we have all these others. We have now 217 bed in Isiolo, which I'm sure within the course of the week we should be able to attain the 300 bed capacity. And we will be prepared. I'm sure in the same breath, the other counties are all moving towards that goal. And the wholesome arrangement of preparedness, the whole issue of making sure there's awareness by governors and the county commissioners going to the radios, going even to within the public to see the actual practice of wearing face masks, using it's one thing to have hand washing stations, but it's another thing to see actually people using them. It's one thing to have, we have availed quite a large number of face masks, but it's one thing to have a face mask, and it's another thing to put it on, and to put it on correctly, because as I keep saying, most Kenyans, even right now as I drive in Nairobi or in Isiolo, most Kenyans wear their face mask below the chin. It's just like to avoid, or they only cover the mouth and leave the nose out like that.
Right.
We need, therefore, to, as I said, this preparedness is a factor of government, both national government and county government, and also citizen preparedness, because wearing mask is the responsibility of citizens.
That's right, Governor. Of course, it is the responsibility of the citizens to observe those measures that they should. But I want to take you back to the 217 bed capacity in Isiolo County. Would you tell us where these beds are located? Are they at the conventional hospitals or at other isolation facilities that you've identified over the past 1 month?
They are across the county, actually. We made sure that, because you see, this disease, our first case actually didn't happen at the referral or at the county headquarters. It happened in the sub-county. So we realized we have to spread our bed capacity across the county. So there are in Isiolo headquarters, there are in Garbatula sub-county, Merti sub-county, Oldonyiro, and even dispensaries at the far end, because we are sandwiched between counties like Wajir and eventually Mandera, because of the road situation. That we also, those centers that are close to those counties, also we made sure that there are isolation beds that could be able to take care of those should anything happen there. Of course, the other thing is the network that we have built. From the county level, the County Emergency Response Committee, which cascades downwards to sub-county and all the way to Nyumbakumi, and the community health volunteers. We have 720 community health volunteers who work alongside Nyumbakumi for identification of visitors from counties that are affected, from creating awareness among the communities. And also, now that there's the new idea of home-based care, the people who will be at the forefront of that are the community health volunteers and the Nyumbakumi, who actually then will ensure that those who have been asked to be taken care of at the home, who are positive. You see, because we have realized that in our situation in Kenya, quite a large number, 95% maybe, are positive and they are okay. They're just having the disease, but they keep spreading, but they are they are health-wise okay. So those ones need not crowd health facilities. Those ones actually could isolate themselves, and then they are trained on those isolation protocols so that they could actually be taken care of, and making sure that their families are protected. They put basic conditions so
Right.
that the families are safe, but also the patient is taken care of at home. That way we will reduce the crowding at health facilities.
And Governor, I want us to take a look at the caseload in the counties based on the numbers that we have. If you can be in a position to look at the distribution of the 7,886 cases. If you look at the screen there, you see that Nairobi County is still leading with 4,126 of the caseload. Mombasa has 1,623. Kiambu has 334. Then if you are to look at Kajiado, that is 351. Migori 139, Nakuru is 80, Uasin Gishu has 120, Busia has 479. Isiolo is not there, but it has a caseload of 9. Let's look at the distribution in as far as the regions are concerned. You'll see that Nairobi still leads with 52% of the caseload. Coast has 1,779. The Central Region has 359. Northeastern has 68. Eastern Region has 231. Rift Valley 623, and Western has 495. Then Nyanza has 205. And I want to ask you, because you chair the Council of Governors Committee on Health, when you look at the distribution of these numbers, that would appear the load is heavier in Nairobi and Mombasa, or the coastal Nairobi. Do you think these numbers are low because of the measures that have been taken, or is it because people observing the measures? What do you think has been the bigger win for the region, for these counties?
Well, I think the bigger win is because of the president's quick action. You know, the epicenter, this disease, you know, was imported to us from outside. You know, Nairobi is the way it is right now, an epicenter, because of visitors that when the flights were still on and the cases were imported. Initially, there was no community infection, the community spread. So when the president did the lockdown and therefore prevented movement out of Nairobi, out of Mombasa and the coast counties that were initially the epicenters, that lockdown helped a lot in terms of preventing spread from Nairobi, spread from coast. You know, the first 2 cases that happened in Mandera are students who traveled from coast and they went all the way to Mandera. And that's how Mandera had the cases that they have, which I'm glad now they have really managed to control. But the lockdown helped a lot. In fact, the lockdown happened just before Easter, you remember.
Right.
If that lockdown happened after Easter and people were allowed to go for Easter and celebrate Easter with families the way usually Kenyans are, leaving Nairobi to join their families. And you know, those are where the elderly are, and the counties, you know, the rural folks, where the elderly people are. If the lockdown had not happened before Easter, we could actually have had a lot of spread across the counties and all over the country, and the situation would have been worse than it is now. So I think we need to congratulate and appreciate the leadership the president provided by acting quickly and acting also, especially just before Easter, when people were blocked from traveling out of Nairobi and out of, into the rural areas, and therefore the spread could have been worse. So that is why. And of course, then that the regular, I know people are getting bored about this Minister of Health daily numbers, everything, but that actually has also contributed a lot, because people are fully aware how the disease is spread, because every day they are being preached to, and also the numbers are showing exactly how the trend is going, and we are very open about this. And I think that kind of leadership, the Minister of Health, by the President, and also by the Council of Governors, because we meet every Tuesday to assess our situations, share experiences, and work together to ensure that, you know, we get ourselves prepared and also get our communities prepared. So it's
And Governor,
combined effort by the leadership at both national and county levels.
Governor, just to cut you short, so when you look at the distribution of the cases in the counties, and counties like Isiolo reporting just 9 cases, others like Kirinyaga reporting just 1 case, what is the general thinking within the Council of Governors in as far as reopening? Because we know that there has been the thought that those counties that are not affected should be allowed to resume a bit of normalcy. Is that still the general feeling, or what are the governors thinking?
As I said, that we need a serious balancing, because it is about lives and livelihoods. So we have to decide how to open in a manner that we do not lose the gains that we have made. Mm-hmm. You know, we have done a lot of sacrifice. The economy has got beaten so much, but we have contained our facilities are still not overcrowded. We have managed to keep the pace at a reasonable, at a manageable level. Therefore, whatever action we take should be able to minimally affect that gains, because it's also a disaster to have a situation where we now are having a crisis and our health facilities are overwhelmed, and you know, the deaths are becoming so much. So obviously the disease will continue progressing, but it should progress at a manageable level like it is doing now. But at the same time, we have to start with opening the areas that are very much affected, especially the low-income bracket. You know, the Jwakalis, the artisans, you know, those people who cannot hold anymore. So we have to strike that balance. Maybe the schools, we will have to see how that handles, because that's one area that can actually lead to explosion, the issue of opening schools.
Right.
So this has to be a balance. I don't know what the president is going to announce. I don't want to even be in his shoes at this particular time.
Right.
It's a difficult situation for him, and we pray for him. He has really led us very well so far. I think we really have to appreciate that. I mean, compared to what's happening in our neighborhoods, you know, we have done very well, and he has provided very good leadership. But at this particular time, I mean, it is his responsibility. I will not know what I can't know what exactly he's going to announce. But
no, Governor, I bet you would know. You'd have a hint, because you sit at the National Emergency Response Committee on coronavirus.
Yeah. I mean, I don't think it's even. It's just today. I think let's wait. But I think what I have said is the general feeling among governors in our discussions, that we should balance between lives and livelihoods. That's the only juggling that needs to be done.
And finally, because I know at least you have some experience monitoring health matters. So when you look at the spread, because the numbers have been rising every other week, and currently in the month of July, we're reporting about an average of 304. That is the daily average. What do you think? Because even as we talk about these containment measures, what is this trend that is sinister, and especially in places like Nairobi, that we are seeing that would lead to increased infections at every time that you are going ahead to test samples?
Well, I think number one, every day we are testing more people also. That we have to appreciate. So the more people we test, the more positive cases will come out, because the sampling size has grown. Number two, while we still talk about all these preventive measures, and the Minister of Health keeps every day talking about social distancing, hand washing, face mask, and all this, you will realize activities in Nairobi is almost getting back to normal. I'm sure that's what we're observing. As I drive in Nairobi, the traffic is fully back. The crowding is back. But at the same time, the observation of social distancing, face mask, maybe hand washing. I mean, I see a lot of sanitizers on matatus, on every corner, but the issue of especially face mask is a big challenge. So crowding is back, and observation of social distance and face mask wearing is not really happening in the percentage that we need to do, because quite a number of people
Governor,
have their mask on, but in the wrong way.
But Governor, is there evidence that these new infections are coming out of people that have been exposed to public transport, or are they happening at homes, or what exactly is happening? Where is this disease being picked?
Well, I think the disease it's an infectious disease, a highly infectious disease. So anywhere where an infected person is, and you know, the distance is close to the extent that when he coughs or when he sneezes or you know, the droplets could be able to reach the mouth, the nose, or the eyes, then anywhere, be it at home, be it in a public place, the issue is it's a highly infectious disease. So anywhere where there are sick people and the sick numbers are increasing, the more the sick numbers are increasing, the more we also increase our sample size by testing more, then the numbers will keep increasing. But you see, eventually, it is said that 70% of the population will have to get this disease. Eventually, it is not about how many people eventually will get. It is how fast they are going to get. And that is why we are saying the president has done well, the country has done well, because as the spread is going, it is moving at a manageable level up to now.
Right.
Up to now. We don't know what will happen in September or August there, but up to now, the pace is such that our health facilities are not overcome. They are not overstretched.
All right.
The patients are being discharged at a pace that the health workers, the bed capacity are not flooded yet. And that is actually what is more important in this disease, because eventually 70% of the population have to go through this infection.
What percentage?
It's about 70%. 70%, I think, have to. The disease will progress. The issue is how fast it will progress. If it comes if the crowding is there, if face mask is not worn, if you know, these measures the Ministry of Health is giving is not happening, then it will happen in a boom, and therefore then a lot of people flood hospitals. Then the health workers are overstretched, health facilities are overstretched, and then therefore the fatality cases also become that high. But if we move at this pace, then eventually we will be able to go through this and flatten the curve, and by the time it ends, about 70% of the people will have been infected, and most of them, as we have seen, 90-something% are just asymptomatic. They are positive, but they are okay. They are not admitted, and they are not having any symptoms.
So when you say 70%, as you end up, Governor, when you say 70% of the population you have to catch the infection, are you basing it on studies specific to the coronavirus disease, or these are just studies based on infectious diseases across the world?
Well, I think this is what I think I had from WHO, but I think the details we could get from the virologist.
Okay, all right. Thank you so much, Dr. Mohamed Kuti. He is the governor of Isiolo County and also the chairperson of the Health Committee. at the Council of Governors, and all the best, even as we wait for the President to make that announcement. I was hoping to hear what your advisory is to the President, but all the same, we understand what the governors feel generally. Thank you so much for that. We now take a short break. When we come back, we'll be speaking to Dr. Moses Masika, who is a virologist working with the University of Nairobi. Of course, you can see him there. We'll be speaking to him shortly. And of course, we'll be starting with that question about that 70% of the population will have to catch these infections. We'll also be looking at the latest in terms of the numbers and the trends that have been observed since the pandemic broke out in March, that is, in the country. We'll be back in a moment.